Hi everyone, my name is Sydney Fudge, and today I'm presenting my communication project on how nurse burnout impacts patient communication and safety. As someone planning to work at the bedside, this topic really stood out to me because communication is such a huge part of nursing, and burnout is directly affecting that communication. To give a little bit of background, I am currently a pre nursing major at LSUA, and I'm specifically interested in patient centered care and healthcare communication. Some credits I want to thank Mrs. Sarah Barnes for her guidance as well as the researchers whose studies helped shape this project. The more I researched this topic, the more I realized that burnout isn't just about being tired. It changes how nurses connect with their patients. A little bit of project overview is this project focuses on nurse burnout as a communication barrier within hospital environments. Instead of treating burnout as just a personal issue, I approached it as a systems issue. Something leadership and administration need to address and understand. The goal is to raise awareness about how burnout weakens patient centered communication and propose structured solutions that improve support system for nurses. When we talk about burnout, we're really talking about emotional exhaustion. Nurses are expected to be empathetic, patient, and emotionally present even when they're overwhelmed and understaffed. Over time, that emotional strain can lead to withdrawal. Communication becomes more task focused instead of relationship focused. Instead of how are you feeling, it becomes here's your medication. That shift might seem small, but it makes a big difference when it comes to patient centered care. So the next question is, what does the research actually say about this connection? Let's take a look. The research really supports this. One study found that higher burnout levels were directly linked to lower patient centered communication. Nurses experiencing burnout were less likely to show empathy or emotional engagement. What stood out to me here is that communication declines not because nurses don't care, but because emotional exhaustion limits their capacity. Another study included interviews with nurses who described feeling emotionally drained. One nurse said, "It's hard to keep giving emotionally when you're so tired." That line really stuck with me. It added a human voice to the data. It showed that lived experience behind all those numbers and statistics. A third study showed that nurses reported a much higher burnout and lower job satisfaction compared to other healthcare workers after COVID-19. When you put these findings together, it's clear that burnout doesn't just affect mood, it affects communication behaviors and patient experiences. So, instead of saying burnout is a problem, I wanted to propose something realistic. My intervention is an awareness and communication campaign directed towards hospital leadership. This would include short presentations, informational flyers, and email briefings that clearly explain how burnout impacts patient communication and safety. The goal isn't to blame nurses, it's to help leadership recognize that improving staffing, scheduling, and support systems protects not only the nurses but the patients too. But awareness alone isn't enough. We need clear goals and measurable outcomes. The main goals are to increase leadership awareness, improve communication between nurses and administration, and ultimately strengthen patient centered care. To measure success, we could use pre and post awareness surveys, track nurse retention data, and monitor patient satisfaction scores. Change wouldn't happen overnight, but even improving awareness is a step forward. Some key activities would include creating informational flyers, summarizing the research, drafting a short leadership presentation, and developing email templates for communication outreach. I would also propose monthly feedback forums where nurses could openly communicate concerns in a structured, safe setting. These small changes can improve transparency and make nurses really feel heard. But I do want to be honest, burnout is very complex. No single campaign fixes it, but awareness and structured communication are realistic first steps. If implemented effectively, this campaign could increase administrative understanding of burnout's impacts. Over time, that awareness could lead to improved communication transparency, better morale, and improved patient satisfaction trends. It's important to be realistic that burnout is complex, but awareness is the starting point for a real change. Altogether, nurse burnout weakens empathy, and patient centered care it doesn't do well when there's no empathy. Addressing burnout isn't just about supporting the nurses, it's about protecting the patients as well. However, barriers like budget constraints, staffing shortages, and resistance to change could slow progress. That's why communication between nurses and leadership is so important. Moving forward, this campaign could begin in one hospital unit as a pilot program and expand from there. Burnout metrics could also be integrated into quality improvement initiatives. If healthcare organizations truly want patient centered care, they must invest in the nurses who provide it. As talked about earlier, here are some of my references that I use for my research. Feel free to click on the link and read for yourself. Thank you and have a great day.